As more and more Americans get fully vaccinated, many of them are wondering what that means in terms of their daily lives. What can they safely do now? What's off limits? That's the topic of this week's Healthcare Triage. The CDC has released guidelines on safely going about your business if you've been fully vaccinated. While some precautions should still be taken, there's a lot you can do now that hasn't been considered safe for quite some time. Lots of outdoor activities without masks are now back on the table. Things like small outdoor gatherings with other people, including outdoor dining. Crowded outdoor events like parades are also safer now for vaccinated people. Plenty of indoor activities have also been given the green light. Some of these activities include going to the hair salon, using public transportation, attending small indoor gatherings, going to movie theaters, and attending indoor exercise classes. And of course, keep in mind that the CDC can't estimate risk perfectly for every activity. A lot of this is about your personal tolerance for risk. You'll also want to keep an eye on what spread looks like in your community or in the community where the event or activity that you're considering is taking place. More caution may be necessary in areas with high case numbers. And of course, the more people you spend time around, the higher your risk of exposure to the virus, so you might want to balance your activities accordingly. While we know that vaccinated individuals enjoy pretty high, though not bulletproof, levels of protection, we're still working out the answers to other questions, like how long protection lasts and the extent to which vaccination prevents them from spreading the disease should they be carrying it. Data so far on that last point are encouraging, meaning right now it looks like vaccinated people are also protecting those around them from getting COVID-19, but these data are still early and we don't yet have a solid picture of this right now. So, for now, we're going with better safe than sorry. It might be frustrating to continue with so many precautions even though you're vaccinated, but you gotta look at the bright side. There's still a lot more that you can do and you are massively protected. Also, we just aren't at a point where we can declare this pandemic is over. We still got a lot of cases and we still have things like variants to worry about, and still too many people are not yet vaccinated. On the other hand, some people are struggling with a return, even a slow return to life as we once knew it. After more than a year of warnings and stay-at-home orders, it can feel scary to be dropping precautions when COVID cases are still out there. This is reasonable, and we certainly recommend keeping many precautions around for right now. But look, outside activities are pretty safe. Hanging out with vaccinated people outside or even inside is pretty safe. Things are much better than they were, especially if you're vaccinated. And if more people would get vaccinated, we could really start loosening up. As I wrote recently in the New York Times, there will come a point that we have to start letting our guard down. We'll need to ease back into a life with less restrictions, understanding that COVID will likely always be around. If that sounds scary, remember that even pre-pandemic, life was a trade-off between risks and benefits. We do a lot of things every day, like drive cars, or cross the street, or answer phone calls with no caller ID, just because we're desperate to talk to another human being. All of those introduce a fair amount of risk into our lives, risks that we accept in order to live the kinds of life we are accustomed to. There will come a point when we can consider that kind of trade-off with COVID-19. We're not there yet, and as I wrote in my article, we'll need to strike a balance between what is ideal and what is doable, both now and after we've declared the pandemic over. Hey, did you enjoy this episode? You might enjoy this previous episode on the FDA's ban on menthol cigarettes. We'd appreciate it if you subscribe and like the video down below, and consider going to patreon.com/healthcaretriage, where you can help support the show even during a global pandemic. We'd especially like to thank our research associates, James Glasgow, Joe Sevitz, Josh Gister, and Michael Chin, and of course, our Surgeon Admiral, Sam.